Thank you for joining us today. My name is Susan Evans, and I am honored to welcome you to today's discussion to explore optimizing brain health. Today is for you. Our objective today is to have a conversation with the presenters and audience. Please ask questions. You have incredible resources to share with you words of wisdom. Thank you, Kensington Senior Living, for supporting these powerful educational events for our aging community. I was first introduced to Kensington in 2015. Our family made the difficult decision to move my father to Kensington in Northern California. He was living with Alzheimer's disease, and it was greatly impacting my mother's health. I did not want to lose both my parents to this dreadful disease. Kensington gave my mother her relationship back with Dad as she joined him at lunch each day, and the struggle was eliminated. Kensington took on the heavy lifting. Today, we will have a roundtable conversation with Dr. Frank Longo, Dr. Scott Turner, and Dr. Lori Ryan. Please join me in welcoming them. And again, thank you, Kensington, for hosting. Can you join me, doctors? I can't do this alone.
Happy to do it.
Thank you so much for joining us. And I'd like to welcome you. And the way that the webinar is going to go today is it's really going to be a conversation amongst these three amazing individuals. And so we're going to start by having them share a few words about themselves, kind of why they do what they do. And let's go ahead and start with Frank, please.
So thank you, Susan, and it's a pleasure to be here. So I'm a neurologist. I trained in neurology after medical school. I'm also a PhD neuroscientist, and so I've done both patient care and research. And my goal in the research has been to create therapies to prevent degeneration of the brain.
Okay. And let's go ahead, Dr. Turner, Scott.
Hello, I'm Scott Turner. Thanks for coming today, and we hope we can get to all your questions. I'm a neurologist at Georgetown, Washington, D.C. I'm a dementiaologist and an Alzheimerologist, and I also started out with some basic research on protein processing, and then moved into mouse models, but now more recently into only human studies and clinical trials, and we are discovering new biomarkers of the disease, such as the new blood test for Alzheimer's disease, and developing new treatments. And so a couple of new treatments have been approved in the last few years, and this is just the beginning because there's a lot more in the pipeline.
That's wonderful. And Lori?
Sure. So I'm Lori Ryan. I'm the neuropsychologist of the group, and that means I'm a trained clinical psychologist with a specialty in neuropsychology. And as a neuropsychologist, I've been involved in that means we work in neurological conditions like Alzheimer's and traumatic brain injury. And I have almost 30 years, I hate to say that, experience now in both the clinical realm of working with individuals with dementia, also in research. And I'm very happy and excited to be here to have this conversation with Scott and Frank.
No, and for the audience, I'm going to just remind you that we will be sending a follow-up email with links to the webinar for you to share with family and friends. So please ask your questions as you have these amazing people live now. And we will get to those as soon as we spend a few minutes asking each of our presenters about why achieving optimal brain health is important. Why are we here today? Why is it important? Dr. Longo?
Well, sure. Yeah, why is brain health important? And for many reasons, but I think as a clinician, what I've noticed over the years as people are living longer, interestingly, as our colleagues in the other fields, cancer and cardiovascular disease, keep making progress. I mean, certainly they have more progress to do. But in our neurology clinic, we're seeing patients who are making it into their 70s and 80s, fairly fit, but then when they come down with a dementia, you think, wow, this person could otherwise be having a fairly active life, doing quite a few things,
Mm.
but it's the loss of their brain function that's really their limiting factor now. So we want to keep people's brain healthy as long as we can during each part of their life.
You know, it's funny. I was just thinking about that. You know, you get to be 70, you played a lot of tennis. I know Ann plays a lot of tennis, pickleball, all that stuff. and suddenly you need new knees and you do a knee replacement. Well, you can't really get a new brain. So I think
Yeah.
that the physical health has more treatable options for us available. But brain health, I saw it both with my dad with Alzheimer's and then my mother with Parkinson's and how critically important that is. And it's sad that you have everything else intact except for that, for sure.
Mhm.
Um, Dr. Turner?
Yeah, I agree with Frank that the longevity epidemic, everyone is living longer, so we're getting more quantity of life. But along with that, we would like to have quality of life.
Mm.
So we have watched patients get demented over many years and wanted to do something about it, and now we finally can. But there's also a lot that people can do for themselves, and we'll get into what those things can be. But we're finding more and more evidence that lifestyle, diet, exercise, etc., make a big impact on risk of getting dementia and Alzheimer's disease. So if people do all the things that they can do to preserve their brain health, then I think that's very important to maintain quality of life in addition to quantity of life.
God, those are the two cues, and I couldn't agree with you more. Who wants more quantity if they don't have quality? Go
Mhm.
ahead, Dr. Ryan.
Yeah, so I mean, it's hard to add to what they just said, but absolutely. And I have a personal connection as I watched my father, like you did, Susan, have Alzheimer's and end up needing care, full care towards the end. And he did live to a ripe old age of 96, almost 97. But what his quality of life would have been like had he, not had the dementia for the last 10 years, I think would have been fabulous to have seen him remain active. But, there is this scientific connection, right? The brain body is connected, as Scott was saying. So, what we do physically, our lifestyles can impact our brain health. And I think that's very exciting in that it's something that we can control. We can't always control our genes, right? Whether or not we inherit something, but we can work on our lifestyle. And as Scott said, I think we'll be talking about that with you all shortly about what are the things we can really kind of take control of and help our brain health. But it's critically important for our quality of life as we get older.
And we are going to talk about that. I want the audience to know that, optimizing your brain health. And I know Dr. Brian, who's been working on this with the Alzheimer's Association, the Pointer Study. And so we will get into some specifics. So I just want to encourage the audience, if you have any specific questions about that, one just came in about exercise and moving blood through the brain. And we'll get to that, David, in just a minute. But before we do that, primarily our audience are somehow associated, um, potentially, not everybody, but with someone, a loved one or someone that they know that is challenged with dementia. And so let's spend a minute just talking about the role of the caregiver. Lori, you went through it with your father. I went through it with both of my parents. And let's just talk from your perspective, because I know that you really support the entire family in the process. It's not just working with a person with dementia. Lori, let's start with you on that.
Sure. As you said, I was a caregiver and I had the great fortune to have my dad at Kensington Park, where he got exceptional care, which was a huge relief and lifted burden off of me as being his primary caregiver because he was a widow. My mother died, at 69 from cancer. So he lived a very ripe old age. But again, when he developed the dementia, things like taking the car away from him, having to do things like that were much more challenging. And it's very stressful, even for myself as a neuropsychologist. I had worked in the field before my dad got dementia. But I was extremely stressed and moving him from where he had been living to assisted living. It did not go easy the first few months. It was very, very stressful. He, every day he's like, I want to leave, I want to go. And I knew better, but it was still very, very stressful. But having Kensington Park, having them to rely on, having friends to rely on, I think the biggest thing for a caregiver is you've got to take care of yourself. And that's often the hardest thing to do, Susan. You know that you're like go go go, and it's really you're no good to anyone if you don't take time for yourself. And you need to exercise and try to sleep and all of the things that to take care of your health. So I think those are the lessons learned, right? Even for someone who's in the profession, it's still extremely stressful, even though it's probably going to get better. And you've got to take time to take care of yourself. Those are, I think, the big lessons that I learned, both professionally and from being a caregiver.
And it's all those micro minutes I mean, sometimes you don't have to carve out 30 minutes to go for a walk.
That's
If
right.
if you know you have 12 minutes, just start walking. And then it's amazing what it does for your body and your mind and all that stuff.
Absolutely.
Frank, any thoughts on the role of the caregiver?
Sure. I mean, that's just critical on lots of levels, right? I mean, we worry about the caregiver and their health, and the ability of the caregiver to function then, sets the tone and the environment for our patient that we're taking care of as well. And helping a patient, it gets more and more complicated, right? They have to get to their appointments, they have to get their tests, they have to be trying to do strategies that we recommend in the clinic. So becoming a caregiver continues to become a complex, important, job almost, really. And even within academic medicine, there are people devote their careers to studying caregivers and studying how they're affected and looking for ways to help them. So fortunately, it continues to be an important area in the field.
Dr. Turner?
Yeah, I totally agree with Laurie and Frank and with what they said, that we know the caregiver is at risk for disease just from the fact that they are a caregiver. And so we stress the importance of respite care. So we would not want to have a situation of only one person providing care 24/7, 365. You have to have some respite from somewhere, and this could be from family, from hired help, or looking at different living environments. So at some point, it becomes almost impossible to keep someone at home. And I know that's a goal for many people, but you do have to have some respite. And at some point, and it's a very individual decision, it's best for all involved to change the living environment.
I just read something or heard something about these multi-family dwelling units, kind of similar, if you studied the blue zones, why people live so long, because they're multi-generational and the grandparents are helping the grandchildren or the great-grandchildren how to read, and they're gardening to prepare the dinner. And it's just very much like that. But there was one that was dementia focused for families to come to so that they had kind of dementia support centers. And if that could be affordable, that would be a great solution, I think, to have built-in support of people that are challenged with your same day-to-day life.
Yeah.
Um, well, tell the caregivers out there, take a few minutes for yourself any way you can, please. Um, Frank, what does brain health really mean beyond not having a disease?
Sure. What is brain health? And I think all of us, bring different angles to this really important area. What is brain health? Um, for me, as somebody, who's developing therapies to delay or prevent dementia or slow it down or stop it or even reverse it, um, I think about synaptic connections. Our brain has billions of neurons, right? And they're connected to each other through an entity called a synapse or synaptic connection. And as we age, we lose a few of those, not an overwhelming number purely with age, but we do lose a few. But in Alzheimer's and these other dementias, and indeed many neurologic conditions, we're losing those synaptic connections. And so for me, a healthy brain is one where we're not losing those synaptic connections. And even better, we can form new ones. So when we're learning new things, we form new connections or we reinforce connections so they work even better. Uh, so a healthy brain is minimizing loss of connections. It has an environment where it can form new connections and that person can learn new things. And a second level that's becoming more and more common in the field now for brain health is the area of inflammation. As we get older, we worry about inflammation and, many organs and parts of our body. Um, and the brain's no exception, unfortunately. As we age, we get a little more inflammation in the brain. And again, good health practices that we're talking about here can minimize some of that inflammation that occurs with aging. And we're also learning about the probably very important role of inflammation in Alzheimer's disease. And so my dream of a healthy brain would be for each of us to have good synaptic connections and not much inflammation going on.
Great um, comment, but is there a way to measure? Can I go in and get measured what my inflammation is in my brain?
Not in a research setting. If you had a spinal tap, there are things that could be measured in your spinal fluid. There are experimental versions of brain scans that can tell us something about inflammation. But in routine clinical practices, we're generally not using those kinds of scans or doing
Mhm.
spinal taps routinely. There are blood tests that give us some idea of the body's inflammation, but not the brain per se. So it's great, Susan, that you mentioned that because that'll get into the area of what we call biomarkers that we might talk about
Right.
more.
Right.
But one of the dreams in the field is, wow, we need a blood test or, very doable test where we could say, hey, your brain's got inflammation or not. And we're not quite there yet.
So I have heard, and Scott and Lori chime in here. I have heard, that dementia or Alzheimer's is diabetes on the brain, type 2 diabetes on the brain. Um, does too much sugar or does a type 2 diabetes diagnosis increase your chances of inflammation in the brain? Is that why it's linked?
Do you want to start, Laurie, or should I start?
Go ahead, Scott.
Okay. Well, there are lots of risk factors for dementia and Alzheimer's disease. Number one is aging. Number two is family history or genetics. But after that, there are a lot of other risk factors that are potentially modifiable. And one of these is diabetes. And so diabetes is definitely a risk factor for Alzheimer's disease. And there are ways that you can try to prevent getting diabetes or treat diabetes. And these are things like, healthy diet, maintaining a healthy body weight, ideal body weight throughout your lifetime, and exercise. And then if you do happen to get glucose intolerance or diabetes as you get older, then getting adequate treatment for that with, diet, exercise, body weight, and medications. And now there are better and better medications for body weight and diabetes that are coming out recently. So that's definitely a risk factor. I don't think we really understand why it's a risk factor. There's, several theories. One theory is that it might affect the blood vessels going to the brain, but I'm not sure if that's really all of the explanation or not. But diabetes absolutely is probably the most important and probably the most important modifiable risk factor in my mind.
Oh, that's good to know. Um, Lori, a lot of questions in about brain stress connection.
Yes.
Um, how can we reduce? I mean, this seems so trite. You're too stressed. You got to reduce your stress. That's like saying to the caregiver, you need to take an hour a day for
Right.
yourself. I mean, it's like really, but how can we reduce? I know you have some thoughts on this chronic stress and how do anxiety and depression affect cognitive processes like attention and memory? So that was a big sentence to say,
Yep.
how does stress affect my cognitive
Right.
ability and memory?
And I think we can talk about that. So, yes, stress does affect your ability to pay attention, your memory. I think everyone knows that when they're stressed, they feel disorganized and they can't focus. But what is also true is that stress can change the brain, right? It can actually cause inflammation, right? We're finding out that that stress connection, what we just talked about, which is, not good for your brain. It's not, especially as we get older. So I think and it can affect not just dementia, but also arthritis, diabetes, or a lot of other conditions that can be affected by stress. So one of the first things we have to do is does it look like when we're stressed? I mean, we think we know, but not necessarily. For older people, it can be having headaches, it can be having digestive issues, being irritable, having heart palpitations, poor concentration, sleep problems, social. Those are all the kinds of those are signals that you've got to start paying attention. That's the first step. What do we do, right? We got to know that we're having it. And what are some strategies that we have found that work to help reduce stress? Well, one is diet. We just talked about that for dementia, but it's also very true for stress. So eating a balanced diet can really actually help. It helps with sleep. It helps our immune system, and so that's important. What one thing you don't want to do is when you get stressed out, eat like a bag of chips. It's not that you can't have chips, but you don't want to overindulge in that. So you've got to sort of modify what you eat. When you're stressed, vegetables, fruits, the healthy diet, what Scott was talking about for dementia, also for stress, a Mediterranean style diet where we're looking more at fruits and vegetables and healthy grains, right? And fish. We're not looking at so much, high saturated fats. We're not looking at a lot of red meat. Staying hydrated, believe it or not, is very helpful. Exercise, critical, for everything that we're just talking about. Exercise is a proven stress reliever, right? Um, Taking time to relax and recharge. And one of the ways we can do that is through things like meditation, right?
Mhm.
Breathing exercises. Those are things that we have found that can actually have an impact on stress and then may also have an impact on dementia. So, and of course, getting enough sleep, right? That's when I think I'm personally guilty of not getting enough sleep a lot of the time. And that's not something we really need to do. And that, of course, being stressed, you can be anxious and depressed. That also does affect your ability to pay attention and to remember. And also, having anxiety and depression can be a risk factor for dementia. So not only can it cause problems in our cognitive abilities, but it's can also, under chronic conditions like stress, can be a risk factor for going on to develop dementia. So there are things that we need to do, and there are things that we can do. But I think, Susan, you hit the nail on the head. How do you carve out the time? You have to make this important because your brain health is too important.
Yes. And actually, that's going to move me right into there's a lot of questions that are coming in about sleep and diet and exercise. So let's just kind of get into that now. And Scott, I'm going to start with you. What types and what amounts of exercise are most productive for brain health? Aerobic versus resistance? Any thoughts on that?
You have to do both aerobic exercise and resistance exercise. There's something called sarcopenia with aging, which means that you lose muscle just as a part of normal aging. And you lose about 1 to 2% of your muscle mass every year, unless you do resistance exercise to maintain it. And you also have to have good cardiovascular exercise as well. And I would recommend at least 3 times a week or perhaps every other day, at least half an hour of some form of cardiovascular exercise as well as resistance exercise. And that's the minimum. And also find exercise that you enjoy because that's the one that you would maintain over the long term. Don't force yourself to do something you don't want to do. You find something, some form of exercise that you enjoy doing, make it a social event, and then do that.
I muted myself. Sorry about that. But
Yeah.
I was
Yeah.
thinking about when we were talking before about the caregivers, we were talking about stress and all that stuff. I think, and you will know this better than me, but you have 10 minutes.
Mhm.
And I actually could go walk around the block and just do a nice 10-minute walk. And then maybe the afternoon, maybe I have another 10 minutes. So can you like when you have a couple minutes, just go do it? Does it all have to be at once?
It does not all have to be at once, but should add up to at least half an hour
Hmm.
every other day as a minimum. And if you can do more than that, that's even better.
Oh, good. And I did an event with Dan. Oh, Dan, he lives in Oregon. He's actually a neurologist. He has Alzheimer's. And when he diagnosed himself and then his colleagues diagnosed him, he got an Apple Watch and he
Mhm.
actually clocks his steps every day, which is a
Mm.
part of the pointer study. Um, Lori, do you want to talk a little bit about the pointer study and the facts in there? Because everybody's asking questions about exercise, sleep, diet, and all the things. Could you just spend a minute and maybe Frank and Scott can chime in on the real important results of that study and how it's linking science to lifestyle?
Yeah, so the U.S. pointer study was actually it has is critically important, still going on. The main study is finished, but they're continuing to follow participants. So we're going to see what the effects were of the intervention over longer periods of time. But there were two different interventions, and it was looking at exercise, okay, also looking at cognitive training, and there was a structured group who got very structured prescription on what to do in terms of the exercise, the cognitive training. And then there was a group that wasn't structured, but got the health information. And they still met occasionally with a coach. The group that was structured also met with a coach. And really both groups did better in terms of cognitive health, but the group that was structured did the best. So I think the findings are incredibly important. They're the first ones to show that we can have an impact. And these were people who didn't have dementia. Let me back up and make sure understand they didn't have dementia, but they were at high risk, right? Sedentary, having not necessarily the best diet. So they also wanted to have a dietary, again, this idea of a Mediterranean healthy diet. And if we put that together with people, does that impact, your health and your cognitive functioning? And it did. And so the important thing now is there were some imaging studies, there were some looking at sleep factors, they were looking at vascular health, and the data is just still coming out from the studies, but certainly it did improve sleep. Vascular health improved. There's still the neuroimaging findings. It was not quite clear exactly what was going on there from the structure group to the not structure group. So that's still being teased apart, if you will, Susan. But the overall message is it did have an impact. It's the first study to really show that we can do that. And what now we want to see what happens over time, because you're going to get drift, right? People probably aren't going to be doing it to the same level they did in the study, but is it still going to have an impact on your functioning? So I think those are critically important questions. But this is a game changer, I think, for the field, that we've always thought this, right? But now we have evidence that it can really make a difference.
That's very encouraging. And I will just remind the audience, you have non-modifiable risk factors. That's your genes and your genetic relationship with dementia
and aging and aging.
and aging
Yes.
and aging. Oh, I guess that is non-modifiable. And then you have modifiable, which we're talking about now. But a question came in, and I'd like to Frank and Scott and Lori as well. So this person, they're anonymous, but I will answer your question. They were told they're at risk for Alzheimer's because of the blood tests and the MRI. So they were said that they had a risk. They said, can the Pointer study and some of the results from that actually reduce that risk? What do you think?
Well, it's a good question. Lori, you could maybe start, since it's the Pointer study, and
Yeah, so let's
comment
be
too.
clear that the Pointer study isn't looking at dementia per se, right? So they are looking at the factors that are risk that we know are risk factors associated in cognitive health. So
Okay.
that's why it's going to be important to follow people over time. I'm sorry, guys. I'm at home and my cat is trying to walk across my screen. So I'm just going to put her over there. So
Maybe you should discuss the risk factors that put them at risk in the Pointer study.
yeah. So again, sedentary, not having a good, not being physically active, having other cardiovascular risk factors,
And
being low.
some had a family history, right?
Family history, and I would say having basically also low levels of education and things, which does tend to put people at risk. So this was a real community sample. If that isn't always the case for our trials, but these are people based on, like Scott said, family history, cardiovascular risk, sedentary, not good dietary habits in terms of like Mediterranean diet. That's really what we're talking about. Those all put people at risk. People were from lower socioeconomic groups who don't always have access to the same levels of, healthy food and things like that. So those are all things that put people at risk. And that was the group that Pointer, thank you, Scott, was actually looking at.
Okay, so a question just came in. I'm not sure if it's from the same person. What role do environmental factors have in brain health? There's a big.
Yeah.
Happy to comment environmental. I just wanted to comment on exercise still before we leave that topic, because exercise is so powerful. I mean, I view it like a drug. I mean, it's a very biologic effect. And the question was if you have Alzheimer risk factors. I'm not sure what kind of MRI scan is being talked about here, or blood test, but let's say we get back some kind of testing that indicates we might have the beginnings of Alzheimer's. The exercise studies, there's been quite a few, and the good part is they've done them both in people that still have normal cognition but are at risk for Alzheimer's, and then they ask if doing exercise delays onset of losing cognition or makes it less likely. And many of the studies, point to an effect of delaying onset or making it less likely. But the question comes up, well, how far along can somebody be and still have a beneficial effect from exercise? There are many other studies that test patients who already have some cognitive loss. So they're much further down the pathway, unfortunately, generally with Alzheimer's. And then they start them on an exercise trial. And even starting at that relatively late time, the people on the exercise versus non-exercise, the exercise is still showing a benefit in many of these trials of slowing things down. And so I think it tells us that the exercise effect can be very powerful, and relevant along the entire pathway. Of course, ideally start it before you lose cognition. So I think it's worth trying that. Um, Another question I get is, well, which one's more powerful, important of the three or four things we talk about: exercise, diet, cognitive exercise, or sleep? Those are the big four that often come up, right? And I'm being purely biased here, but as I study these studies and read about their biologic effects and make some of the measurements that are talked about here, I keep coming back to physical exercise. I think all four of these are important, but I'm so impressed over and over again about the biologic power of physical exercise. It just I tell my patients and families, if you are lucky enough to be able to do some kind of physical activity, whether it's walking or swimming or working with a trainer or recumbent bicycle, whatever it takes for you to be able to do some kind of exercise safely. We don't want people to hurt themselves. You are blessed with an opportunity, and I hope you're taking advantage of that.
A question just came in from John. I'm going to ask you right now, which is a great question. Is it better if you have the ability to do strenuous exercise, getting your heart rate up?
Well, I think, as Scott mentioned a little bit, and there was a study done at Stanford a few years ago. The different kinds of exercise have different kinds of effects, and it's good to get them both. So the aerobic exercise seemed to affect certain genes and certain proteins in the body, which can be beneficial. But interestingly, the resistance kind of exercise activated a different set of proteins and genes. It was fascinating. And I think you would want a little of both, ideally. So what Dr. Turner said, from what we know of clinical experience, seems to be playing out when these scientists measured the genes and the proteins. Same answer. And one thing I'm finding interesting, you might see marketed these blood tests. We don't do them routinely clinically, but you see them marketed for what they call epigenetic measures in your blood test. They're measuring your epigenetic changes of your genes, and they change as we age. And so these are commercially marketed, and the various opinions on how reliable they are. But when they do these epigenetic measures in blood tests, some of the aging effect that can be detected can be reversed by exercise, and the two different forms of exercise, the aerobic versus the resistance, affect different genes in those kinds of tests. So I think, Susan, the answer is, ideally, if somebody can mix it up during the week and try to do a little of both.
Right.
That's a really good point. And it's interesting because you talk about exercise maybe being at the top of the list.
That's
And
my just personal list. I can't prove it. And the
but
other
I'm
things are
gonna,
important too.
It's the
I'm gonna
top of
no, but I'm gonna
top of my list too.
but exercise makes me reduces stress. It makes me, first of all, it does so many things for me. Sometimes if I can hike with a friend or I can be with a friend, it gives me that nice social time that I can be there. And I couldn't agree with you more about exercise being so critical. I agree with that. Scott, I'm going to go pivot to you now about how can we optimize learning and memory across ages, children, student, older adults.
Yeah, well, for younger people, if you really want to remember something or have, memory, there are factors such as repetition. So you have to repeat things, and ideally, in between the repetition, you have good quality sleep, including REM sleep. So there's something called consolidation of memory during sleep. Obviously, you'd want to avoid any drugs or substances that may impact your memory or affect your memory adversely. Um, but with older people, it's more about preserving memory. And that's where we get into all these lifestyle modifications, environmental things, including exercise diet, Mediterranean diet, which includes a lot of olive oil and very little in the way of solid fats. I'll mention one study that I saw recently about exercise, and that was looking at older individuals who had some amyloid plaques in their brain. And so this is one of the pathologies of Alzheimer's disease. And they had equal amounts of plaque, and one group was given exercise and one group was not, or just given stretching or whatever. And then they looked at the other pathology in the brain, the tangles, and those who exercised had much less of the other pathology compared to those who did not. So so we think what happens with aging is amyloid accumulates in the brain, affects your memory. It causes accumulation of these tau tangles, which is the other pathology of Alzheimer's disease. And the tangles is what really drives the cognitive decline and the memory decline. So the exercise was able to overcome the toxic effect of the amyloid in inducing the tau pathology. So this was a very powerful, a very interesting study. And if you look at the dose of exercise needed for this study, it was a dosage of at least 5,000 to 7,500 steps per day, which is really not that much for an average person. So at least 5,000 to 7,500 steps per day will help preserve your memory with aging.
I love that. And the person that asked the question about the environmental um, said, please don't forget to ask that. So I'm going to ask that
Yeah.
again about environmental factors because we kind of lost that.
Yeah, I can touch on that a little bit. So people are often worried about aluminum or microplastics or pesticides but I think the biggest toxic factor in our environment is our food. And the Western diet that has a lot of processed food, that has a lot of fats, trans fats, sugar, especially lots of sugar in our diets. So I think to me, this is the biggest environmental toxin that I would be worried about.
That's
Yeah,
kind of scary.
Yeah.
I would add there is some data now in addition to what we can really control our diet that things like air pollution and things do seem to have an effect on the brain and looking at areas in the country where people are more exposed there is some so that we still don't know the extent but there is burgeoning evidence that yes, our environment and of course stress can be in our environment too, right? Can absolutely have an effect. But I agree with Scott. One of the things I think which is great about diet is that we do have more control over that. We always can't always control what neighborhood we're in, how much we're exposed to, how much car noise, things like that. But that's one of the things we can take control. And I hope that is one of the takeaways that we leave with folks today is that there are things that you can do no matter what that will help your brain health.
And another environmental toxin is smoking.
Yes, we've learned a lot about the negative impacts of smoking for sure. And one message is what's good for your head is good for your heart and good for your whole body. So I hope everybody leaves
And
with
another
that.
one is too much alcohol.
Too much and what is too much?
Yeah, that's a good question. It's more than your clinician.
Oh.
Yeah.
Oh, so when the doctor says how much alcohol do you consume, you turn it around and say, "Well, I was wondering how much you consume."
No, officially it's well, there's a recent study that came out that said no alcohol is best, but prior studies suggested that maybe one serving a day of alcohol may be optimal, and that's one serving is not a lot.
Yeah.
No.
It's
Yeah.
it's funny, the alcohol studies became interesting lately when they said, well, maybe zero is the best level. And then so they went back and they looked, well, why did the previous study suggest one or two might be better? And using more modern and powerful statistical approaches, what they found is when they surveyed people, the people that said that they drink zero amounts often had some kind of medical issue in the past, and that's why they weren't drinking anything.
Mhm.
And so they were having that medical issue in the past, means they're going to have more medical issues more likely. And so it looked like people who drink zero were getting a little more sick than the people who drank one or two. And the statisticians are now saying, oh, that was a fake out, that it's actually you're better off with zero. But I mean, what I advise people is we're talking about stress earlier. If having a drink or so here and there reduces your stress and adds to your quality of life, I'm not going to try to argue against that. But those are the most recent numbers.
Well, from alcohol, let's go to supplements. I get a lot of questions about should I take Prevagen or should I take different things that you see on the TV, or should I be taking omega-3s and should I be taking B vitamins and how many different supplements should I take? Who would like to start with that? I know it's a big question.
I mean, I could say a few comments. I don't know, Lori, I don't know if the NIH has funds supplement studies. I think they do, or
There's been some,
assessments.
yeah. I mean, I
Yeah.
can not. There's been some old studies on looking at omega-3s and things like that. Again, with mixed results. I think the only positive supplement result was from the study that was called Cosmo, which was looking at cocoa flavonoids versus a multivitamin, Centrum Silver specifically, and so they didn't think that the Centrum Silver was necessarily going to be anything. It was more of a control, but they actually found that the Centrum Silver did have an impact, so it did seem to be beneficial. So I quite frankly, that's one thing I actually do take now after I saw those results because it's not going to hurt you. But there is some data for that. But really, for the other things, and I'm not aware of any studies, I don't know, Frank or Scott, that have looked specifically at those over-the-counter commercial products either, but I'll
Yeah,
let you know the evidence
it,
for those. Yeah.
it's a complex field, but yeah, I'm glad you mentioned the cocoa study because I was really hoping for the cocoa on that one.
Me too.
Yeah.
But uh, disappointed. But I think it's a complex field, and every few months I look this up. Um, but let's start with the Prevagen. Maybe that's the easiest one to answer. No evidence, no reliable evidence whatsoever, on that one. Um, and there's just not a really strong basis of why that should work. And there's been limited clinical observation. So that one's easy. I think some of the ones that have been interesting for me, in addition to what Lori Ryan mentioned, was the omega-3s. I mean, there have been dozens and dozens of studies on those over the years, all kinds of studies, and some showing some potential benefit of slowing down cognitive loss, both in people who are still normal and slowing down the chances of getting cognitive loss, or people who actually have some cognitive loss and can it slow down the progression. So there have been some positive studies, but they're not consistent across the field. And you can have some negative studies as well. People tend to do what they call meta-analysis, or they put all the studies together and see if they can come up with a final answer. So I'm still open. There's some possibility that the omega-3s can slow things down. We need better data. But there are several people who've argued that epidemiologically, if you have 1 or 2 servings of fish per week, you will get the full benefit of any omega-3 supplement. So unless you hate fish,
Yeah.
there you go, 1 or 2 servings a week. So I pay attention to the omega-3s. Lori mentioned the multivitamins. Prevagen, we talked about. I don't know, Dr. Turner might have some other ideas, but those are some of the ones I follow.
Yeah, we don't recommend any supplements other than a multivitamin. But at the same time, if someone does start to have memory problem, vitamin D deficiency is pretty common and low B12 is
Mm,
pretty common. So those are things that can be checked in the blood, and a supplement vitamin D and B12 can be given and correct those pretty easily. But all these other supplements, there's just not enough data out there to support
right.
them, including Prevagen and lots of other things. There's been a couple of studies about creatine that have come out lately that may be positive, but I think we need more studies. Um, and people ask about, are there any side effects of these supplements? Well, first of all, we don't really know what's in them because they're not regulated.
Right.
And even though there's something on the outside of the bottle, that may not be what's inside the bottle. And so we don't really know what it is. And I said, well, it may not have any side effects, but it will make your wallet thinner.
Uh, it does. Um, Somebody asked a question that this woman who's in her 60s did a blood test, and I don't have any more data except for she took one, and that she has tau in her blood. Is she going to get Alzheimer's? I mean, is that like you're destined for that, or is there more that can happen if you just have tau in your blood?
Yeah, that's an important question. I'm sure my colleagues can weigh in too. There's a relatively new test that's been approved by the FDA from different sources over the past year or so. It's called Tau 217. There are many forms of tau, and they come with different numbers, but this is phospho-tau 217, recently approved by FDA for a blood test. The FDA approved it in people who are having some cognitive symptoms as a way for the doctor to further assess those cognitive
Mm.
symptoms. And in people that do have cognitive symptoms, if their blood level of tau 217 is significantly elevated, that's an indicator that they could have the beginnings of Alzheimer pathology in their brain. Not 100% accurate, and it has to be part of an overall workup, by the doctor. But we have many people asking us who do not have cognitive symptoms what the test means in that situation. And in that situation, the test is less useful. It's less accurate and less predictive when you don't have cognitive symptoms. So there, most people tend to not recommend it if you're cognitively healthy and don't have symptoms because it's harder for us to interpret. But if you do have cognitive symptoms, it does increase the chances that there is the beginnings of what we call Alzheimer's pathology in the brain. And then that patient should be talking to their neurologist or their physician about, okay, what should I be doing at this point?
Yeah, we all have some level of tau in our blood and phospho-tau in our blood throughout our life. The question is it in the normal range or is it elevated? And if it's elevated and there are cognitive issues, then that's pointing towards Alzheimer's disease.
It's a combination of factors. What about lithium? It came in, Margaret just asked it on the Q&A, and it
Yeah,
was also a question submitted at registration.
I'll let either of my colleagues go first. I
Yeah,
can comment too. Go ahead.
lithium's been around a long time, and so there were some older studies that looked at lithium and didn't look very promising and had lots of side effects. But more recently, there was a study with mice that looked at a different form, a different salt of lithium called lithium orotate. I don't think the salt really makes much of a difference, but it seemed to have some benefits in mouse models. And I don't know if a human study will ever be done with lithium orotate or not, but there's not enough evidence now to recommend it.
There was a recently published small study, not lithium orotate, lithium carbonate, which is the typical one that had some, again, a small study, so positive results in terms of cognitive functioning dementia, but it needs to be replicated. So I agree, there's not enough data, right, to make a recommendation.
And lithium is known for, not having a good side effect profile.
Right,
Yeah.
exactly.
Yeah, I can comment briefly on lithium too. It's a drug traditionally used for other purposes, bipolar disease and other areas. And at the doses used there, lithium has really important side effects, affects the kidneys, very serious side effects. So the hope here is that lower doses might help. And the idea is that the traditional lithium carbonate, binds to the amyloid in the brain. So the theory is that the amyloid's binding up the lithium in the brain. So the brain has a shortage of lithium because it's all stuck on the amyloid. And the lithium orotate does not bind to the amyloid. So maybe it's more available. That's the theory. However, this study was done in mice, which is okay to start off with. But the mice that were used have 5 times more amyloid than a human with Alzheimer's. And so, we don't know if this effect of binding up the lithium by the amyloid, what role that might play in the human. That's what we don't know. So we really don't know if this will be beneficial in people, but it'll be worth further testing.
Deborah just asked a question. I want to get to these last couple questions before our time is up. Autoimmune disease, any effect on the brain?
Could be a lot. I mean, there are many kinds of autoimmune disease of various severities, but quite a few of them, yes, the immune system ends up attacking different kinds of cells in the brain, and an autoimmune disease can have dramatic effects on the brain. And more recently, we're realizing that there were probably people having brain effects from the immune system we weren't recognizing before. And now there are new tests out, blood tests, that with a skilled clinician, who knows how to assess a patient and knows what test to get and put it together, the clinical picture, we're finding patients that, whose cognition is probably being affected by the immune system, and we didn't realize it before.
Yeah, one form of autoimmune disease is multiple sclerosis, which clearly has big impacts on the brain, including cognition. But there are lots of other autoimmune diseases that can affect the brain as well.
There's so many autoimmune diseases. I had no idea until my grandson was diagnosed with type 1 diabetes. I
Yeah,
didn't
some
even know before he was diagnosed it was an autoimmune disease.
yeah,
So,
Yeah.
some people say even Alzheimer's is somewhat autoimmune disease because the amyloid plaque is like a foreign body, it's a foreign antigen, and the immune system reacts to it, and you get a lot of inflammation in the brain reacting to the amyloid. So it's, in some ways you could consider that Alzheimer's a autoimmune disease.
what about thoughts on antidepressants to manage dementia?
Dr. Ryan might know a lot about that.
Yeah, I mean, I think we've talked about that. There have been some studies that have looked specifically at antidepressants. Much of the positive data was in looking at treating things like agitation, believe it or not, because there's not a lot of good treatments for agitation in individuals with dementia. And it's one of the symptoms that will likely get someone put into a facility, right? Because it can be very difficult for family members. So I'm thinking about the citalopram study that was run out of Johns Hopkins that actually found a benefit for agitation. So there's some work. There's been some other smaller studies trying to see if it worked for cognitive symptoms, and I think the results have been mixed for, the cognitive changes. But in terms of agitation, there has been some positive result for actually having an effect.
And we do see a lot of mild depression, mild anxiety associated with Alzheimer's
Hmm.
disease, probably caused by Alzheimer's disease.
Hmm.
And so we often treat depression, anxiety with antidepressants in addition to medications for Alzheimer's. So this is a very common scenario. And depression, anxiety may sometimes even be the very first symptom of Alzheimer's.
It was for my father, and we did treat him with that, and it was incredibly helpful, not
Mm.
just for him, but for his caregivers, my mother, myself, my brother, and all of his family and grandchildren around him. It was very helpful. What about is radiation for cancer linked to dementia?
I can, yeah, potentially, yes. If the radiation field includes the brain, one mechanism that people have been concerned with, radiation prevents cells from dividing, right? That's why it's used for cancer. Um, Parts of our brain called the hippocampus that's important for creating new memories. We also have some dividing cells there that actually can make new neurons, which is great. So even as adult in the hippocampus, we can make new neurons based on dividing cells. So, the concern over the years has been, wow, that radiation's inhibiting our ability to make new neurons. And so that could affect our memory systems. And another mechanism with radiation is, again, brain inflammation potentially. So it's always a risk benefit. Anytime somebody's having radiation involving the brain, the radiation therapists are always very careful about risk benefit and where they're radiating. So it's usually a very careful consideration.
That's good to know. I was just thinking about that. A question came in about PTSD, and can that lead to some type of dementia or effects on the brain?
Yeah, I was going to talk about this when we were talking about stress, because there are, much more severe forms of stress that affect the brain, and this is called post-traumatic stress disorder or PTSD. And we know that this is also another definite risk factor for dementia and Alzheimer's as well.
And then one last question from John. His doctor suggests that he should take baby aspirin that could help with dementia. We're not going to give any clinical advice here, but a lot of people take baby aspirin. Is there any effects on the brain? I know some people take it for their heart and things like that. Any thoughts?
Dr.
Um,
Turner, do you want
yeah, this is mostly looking at stroke and vascular disease.
to?
And I probably would not recommend it preventative, but if there ever was a myocardial infarction, a heart attack, or or an ischemic stroke in the past, and you were recommended by your cardiologist or neurologist to take a baby aspirin a day to prevent another event of heart attack or stroke, then that would be the indication to take it, but not just for prevention.
Right. So really the low dose aspirin, you need to work with your doctor, like what is it really treating?
Mhm.
It-
Yeah, I would agree. I think the low dose aspirin is mainly driven by cardiac and vascular factors, and that's what you want to work with your doctor on. I'm just speaking generically here. I'm not aware of any, particular use for dementia prevention.
well, it's that time now. I just want to thank all of you so much, and I want to thank our audience for your active participation. That's what we want to accomplish here is to answer your questions. And please remember that we will be sending you a copy of this webinar to share with friends and family. You can share it as much as you want. I think it'll be helpful for a lot of people to optimize their brain health. Thank you so much, Dr. Longo, Dr. Ryan, and Dr. Turner. So appreciate it. Have a safe evening or a safe afternoon. Thank you
Okay,
so much.
thank you.
Thank you.
Thank you.